The advent of the XI system creates a robot that has a much smaller footprint. It allows us to do robotic surgery throughout different body cavities, whether it be the chest or the abdomen, with minimal movement of the robot in the operating room. All those things together allow a much more detailed surgery that's in a very controlled environment. There are surgeries that we do on a daily basis in this country right now in a minimally invasive fashion that back when I was in training, we would admit patients the day before surgery, we would do their surgery, and we'd keep them a day afterwards. So that was a 3-day surgery stay that now we're doing as a same-day surgery, and they go home 30 to 60 minutes after surgery. The idea of doing a complex open surgery is more, I think, a secondary thought. The primary thought is how can we best approach this surgical problem that allows our patients to return to a normal, healthier state quicker with minimal impact. For a small hospital in a relatively isolated setting, Door County Medical Center has a keen grasp on innovation and how it plays a role in medical care. The development of the robotic program here is certainly a key in that, but I think that attitude, I can tell you, does not appear often, even in much larger medical centers where I've been.
My name is Dr. Curtis Shear, and I'm a general surgeon here at Door County Medical Center. I'm originally from Fargo, North Dakota, but I ended up doing my surgery training here in Wisconsin, so I've been in Wisconsin since 1992, and I've been in Door County now for 20 years. I'd have to say the very first inspiration probably started almost at birth. And our family doctor was always kind of a hero for our family. Back in that era, the family doctors, especially in rural areas like North Dakota, did a lot of the kinds of things that I do now as a general surgeon. They did delivered all the children, they did operations on their patients, and I came from a large family with 4 brothers, so we spent a lot of time at the doctor. So I was kind of inspired by that. My approach to medicine is really a pretty simple one. I feel that I got really good training in a rural medical school in North Dakota that primarily focused on training primary care doctors. During that training, I was taught that you can learn the most about your patient and what they're suffering from by simply talking to them and getting a very thorough history. So I incorporate that in my practice to this day, where I spend an awful lot of time getting answers to detailed questions with my patients, and that'll focus me in on where we need to go next for a workup and ultimately the treatment. One of the newer technologies that we're able to offer at Door County Hospital beginning about 3 or 4 years ago is what's called transoral incisionless fundoplication. It is known as TIF for short. It's a procedure that allows us to do a recreation of the valve between the stomach and the esophagus to help people that are suffering from acid reflux and can't control their symptoms adequately with medications. What's so nice about the procedure is we can do this operation in less than an hour and with no incisions whatsoever, and with what has been shown in follow-up studies in patients across the country to have a very durable result. Many patients come off of their acid reflux medications altogether and stay off of them long term. Door County has many things that are easy to fall in love with. Obviously, it's a very beautiful place. You can spend time in isolation, going to state parks with other people in area theater and arts, and having been here for 20 years and doing screening colonoscopies, I've got to meet a lot of them firsthand and up close and personal, so as to speak. But the people of Door County are special people. They're very kind and generous. People are always willing to lend a helping hand and come together, whether it's a community project or a person in need, and I've seen that over and over again.
I'm Michael St. Jean, and I'm one of the general surgeons here at Door County Medical Center. It was actually probably my first day of my first medical school general surgery rotation. I can remember it like it was yesterday. I was at Walter Reed Army Medical Center in Washington, D.C., and I wound up scrubbing for a very complicated pancreatic cancer case that lasted about 13 hours. At the end of that, being fairly physically exhausted, I remember talking to my wife on the phone and saying, I figured out what I want to do. I was a late bloomer to robotic surgery. I was one of the original naysayers, at least in my opinion, and I had a former partner who was one of the preeminent bariatric surgeons in robotics in the country, and she urged me to at least try. And as the saying goes, I took a sip of the Kool-Aid and I was sold from there. And so for the last 6+ years, I've been performing almost all my surgeries robotically. The thing that I would like patients to know most about me is that I'm as approachable as anybody can be, and that oftentimes I think patients are apprehensive about asking questions. And I'm always fond of telling patients, you can come in with as many questions as you want. We're going to answer all of them regardless of how long it takes. Sometimes that leads to me being a little long-winded and my appointments run over a little bit, but I always tell people you're going to get your money's worth because we're going to spend time together, and there's not going to be any doubt in your mind that I haven't explained everything as adequately or as if, to the nth degree. I would say, a good day at work is, it may be just one out of several, but one really good patient interaction where I feel like I've impacted that patient's care, whether it's doing surgery, preferably, but sometimes just, educating a patient. When I was in the military, I was involved with graduate medical education, teaching surgical residents, and one of the things I used to always tell residents in their training was that the art of surgery isn't about doing surgery. The real art of surgery is knowing when and when not to perform surgery. And not everybody needs to have surgery, and sometimes I think when you present that to a patient, they understand, or they have an appreciation for the fact that you're being forthright with them. And lots of times, that puts them at a sense of ease and they can make more informed decisions that way.
My name is Sean Malarvey. I'm one of the staff general surgeons here at Door County Medical Center. I always thought that I would be a marine biologist, but in high school, my advanced seniors course for biology, I found that I enjoyed mammalian biology much more than fish. And so it was pretty much then that I decided I would shift my focus, and I became interested in the application of surgery because it's such a direct intervention. I mean, making a physical change, and that appealed to me. And I knew then that I would be interested in medicine with some aspect of surgery in there. My specific role is as a problem solver. Oftentimes, I'm sent the patient with a specific problem. I apply the information that I've learned over my lifetime, especially the last 26 years of my education. My role is to solve those specific problems, and then the secondary role is more direct. Those are cases that are on call. A patient comes in distress with an acute surgical abdomen, maybe a collapsed lung, an abdominal trauma, and then there's much less time, and you have to be fairly abrupt and decisive and immediate, and those are my two roles. What gives me the most pride in my job, but in the past 25 years of my career, I have had specific patients in specific instances where the survival was not assured, and due to the fact that I was on call that particular day, but I'm fairly certain that had I not been there, they likely would not have survived that particular event. I wouldn't say that so much as a matter of pride as it is a matter of fulfillment. I would like to say that I write a lot and I'm working on a novel, but I don't. I spend most of my free time kind of obsessively working in the yard. I bought a tractor, a little utility tractor a couple years ago, and so I'm managing to try to not to hurt myself with that. But that's what I seem to spend most of my time with is, I call it aggressive gardening or landscaping.